Hi guys, I'm super excited to bring you this video. If you have disc, spine or nerve pains that go from your neck to your lower back and the nerve pains affect your periphery, so your arms and your legs, this is how my unique setup is designed to serve you. We have an amazing link to a private imaging service where within days we can image you, and 10 days after that the reports and the images are brought to us. I've worked with a particular consultant for over 15 years now. We have an amazing link, so on those difficult cases where we need further guidance, I can just pick up the phone and we can have a good discussion about our patients. This is a unique service that's not offered within the NHS or the bigger private hospitals. So this is a real case and I'd like you to follow me and have a look at it. This patient had significant leg pain and I was suspicious that this was coming from the spine. So look at this image. So these are his MRIs and this is a cross section of his spine. As we move through the image here, boom, we can start to see some damage into the spine there. So we can see that disc bulging out and we can see some active inflammation over there where the arrow is. I take some other images, some transverse sections across his spine, and as we move down, so we work our way through, that layer looks good. We go down below that and straight away there we see that damage. So from here I can see that's his spinal body, that's the thecal sac where the spinal cord sits. To the sides of that, kind of like Mickey Mouse's ears, that's where the nerve root is. We can see some impingement of that and active inflammation around that coming from basically a burst disc. With this patient, because I did a detailed clinical examination, having these images, I could have, with my clinical experience, I estimated there was probably less than a 30% chance we could help him in clinic. So this allowed us to quickly refer him over for an opinion to the surgeon. Quick, honest and accurate healthcare, ensuring the patient doesn't needlessly spend hundreds of pounds on unnecessary treatments. For those patients that we do treat, check out my unique clinical setup for you. For spine, disc and nerve problems, this is the range of equipment I use on you. This is a spinal traction couch where we strap you in and the machine gently pulls your spine. It helps relieve pressure on your joint and pull back in the disc. For disc and nerve problems and inflammatory problems, we then can use targeted radio frequency that helps reduce inflammation and help rebuild the nerve, helps remyelinate the nerve so the nerve can signal better. We've got various handheld tools for a good sports massage and of course the sports massage gun. I can use belts to help mobilize joints, especially the heavier hip joint. Various different types of needling for superficial needling and onto the bone for bone pains. I've got TENS machines here where we can put pads over you to help pass electricity to have certain effects on the body. We use ultrasound, and ultrasound changes the electrolyte balance within a cell to make you more electronegative and help build good quality collagen, so structural integrity of the tissue that's damaged. And with electroacupuncture, I'm really proud of this unit. I can use this to establish neuroplasticity to see whether we can actually change a patient or not. And if we can, we then use the needles, strap it onto this machine, pass electricity through you to change brain patterns of pain in actual real time. So 2.5 degrees, lots and lots of postgraduate training, over 15 years of clinical practice. I bring that all into here to offer the best possible level of expert care to my patients. And if you go to my website, townosteo.com, I'm starting to put lots of research articles on there explaining how this equipment works. It's really exciting stuff. And over the coming months, I'll be putting more and more information on how therapy works and about diet and nutrition too, and how important that is. Lastly, I would like to talk about time. especially when we talk about treating disc, spine and nerve pains, we really need to spend between half an hour to 1 hour treatment sessions. Why? Spinal traction takes between 20 to 30 minutes. Targeted radio frequency takes 15 to 20 minutes. Using the various massage tools, they'll take a few minutes per area. Basic acupuncture into an area only takes a few minutes. Manipulating joints, well, that'll just take seconds. Electroacupuncture to change the brain pattern of pain, that takes anything from 15 minutes to 30 minutes. Certainly with some of my patients, we combine these therapies in one session. The benefit of that is we work on multiple systems in one go. The sessions might be longer, but overall you get better quicker, and hopefully it saves you money too. So thank you for watching, and do give me a call and hopefully we can get you fixed.